Good afternoon. I'm so excited folks can join us. So for today's Lunch and Learn, we have Beth Florence, who's the program coordinator of the Child Abuse and Neglect Prevention Plan, the CANPP, for the state of Georgia, which is with the Prevent Child Abuse Georgia, which is housed in the Mark Chafin Center for Healthy Development at GSU School of Public Health. So Beth has a background in social work, and she's delivered individual, group, and in-home counseling services to children and families at various community-based clinics. And these experiences have really fed her passion for holistically supporting communities. So we're just so happy that she's here to share more about CANPP's history and also an update on where it is. And I'm just so happy that folks have joined us for this Lunch and Learn. So with every Lunch and Learn, please feel free to eat your lunch, to turn off your video if you need to, and we're going to record the session, and we'll also share resources after this Lunch and Learn. And am I forgetting anything, Nikki, in terms of a welcome? Okay.
I don't think so.
Well,
I'm just really glad y'all are here.
Yes. So we'll jump right in. So I will hand it over to Beth.
Hi, good afternoon, everybody. Thanks for the introduction, Audrey. I'm the Child Abuse and Neglect Prevention Plan Program Coordinator for the state of Georgia. I work under Prevent Child Abuse Georgia, which is one of the backbone agencies with Georgia Essentials. So my main purpose today is to kind of explain what the state plan is and hopefully bring some clarity to what CANPP is all about. The first thing, though, is I was hoping to find out a little bit about who's here, what area, what arena you work in. Feel free to do this or not, but just curious, even if you just want to put it in the chat to let us know. I'm just curious who's in the room. So you can use that QR code. And I've got in the chat, I've got a link as well. So I've been with Prevent Child Abuse Georgia since May. It's pretty new for me. And so I've had to learn this from the ground up. And it's kind of a confusing plan, and there's a lot to it. So, okay, looks like we got a little bit of everybody here today. We've got mental health, social services. Awesome. Okay, I'm going to go ahead and move forward. So if you haven't heard of the CANPP before, the CANPP is the acronym that we use, and it stands for Child Abuse and Neglect Prevention Plan, CANPP. You'll also see it sometimes referred to as Georgia's State Plan, sometimes Georgia's State Plan for Prevention, and then also Georgia's Vision for Child and Family Wellbeing. So there are a lot of different names that it falls under, but ultimately this is the vision of child and family well-being across the entire state, and a focus on prevention, but also expanding our understanding of prevention, moving it outside of just working with children and families, and also understanding that the whole family unit needs to be healthy in order to help reduce abuse and neglect. So in 2020, the plan was developed for all 159 counties of the state, and it was split up into the 14 DFACS regions. My next question for you guys is, how familiar are you with CANPP? Do you know it well? Have you heard of it before? Is this all brand new to you? Because that will kind of give me an idea of how far to go into how it all came to be. And again, if you don't want to use the Slido, then you can just also let us know in the chat. Okay, so some people familiar, have heard of it. Awesome. Okay. So where did Georgia's CANPP come from? So CANPP is part of Georgia Essentials for Childhood, and Georgia Essentials for Childhood use the CDC's framework as a roadmap to put together the CANPP. So the CDC developed Essentials for Childhood. It was developed to guide prevention efforts and expand understanding of prevention with the reduction of ACEs, adverse childhood experiences, and the promotion of PACEs, positive childhood experiences. So it was meant to reframe efforts to reduce abuse and neglect with a focus on prevention and to keep families together, strong and resilient, which goes very well with Resilient Georgia and the work that you all do there. So Georgia Essentials came together and developed a vision. And if you want to use that QR code, the QR code will take you to the Georgia Essentials page, and it lays out the entire plan. Georgia Essentials for Childhood's vision is that Georgia's children and families will thrive in connected, nurturing communities where they live, learn, work, and play. So it's really about the health of everyone, parents, families, teachers, faith communities, everyone plays a part. The mission of Georgia Essentials for Childhood is to develop a common approach using multidisciplinary organizations and stakeholders to align activities, programs, and policies so that all of Georgia's children, youth, and their families have safe, stable, nurturing relationships and environments. The vision really informs the work that we need to do. This mission is about developing a common approach to align activities and programs and policies in the state of Georgia to have those healthy environments for families. Georgia Essentials for Childhood is run or led by 3 backbone agencies. So it's DFACS, Prevention and Community Support Section, Prevent Child Abuse Georgia, and then DPH, Injury Prevention Program. So those 3 agencies are the agencies that came together to kind of spearhead this movement, and they manage all the working groups and the day-to-day of Georgia Essentials. Georgia Essentials itself has 5 different working groups. So those 5 working groups are communications, data, the CANPP, the Child Abuse and Neglect Prevention Plan, programs and practices, and then policy. So we have different working groups to help inform each of those areas. Our policy working group is amazing, and they give us updates on the different areas that CANPP focuses on and what's happening in the legislature. They also have helped us get connected with the CANPP at the policy and legislative level in the state of Georgia. So bringing together all the work that's being done across the state and helping bring attention to prevention that's working and prevention that's needed. So again, CANPP is led by Georgia Essentials, and what Georgia Essentials provides to CANPP is technical assistance and support for the regions. So that's really where I come in. There are leaders in each of the 14 regions, and if you're not sure who the regional leader is where you are, I'll have a list at the end of this presentation, and I can always get you connected. So each region meets and they go over how the plan is going in their specific area, and then I hear from them and take it back to the state. So that way we're really trying to harness a comprehensive picture of what's happening across the state. So that's that also, as it says here, is part of the implementation. Georgia Essentials will also help update this CANPP plan every 5 years. They do an annual review of CANPP to see how things are going, what needs to be changed, and then they provide some additional funding. That funding is very limited. There is a small stipend or participation payment that goes to each of the leaders in the region, but for the most part, it could use more funding. Let's just say that. Okay, so now we know a little bit about the framework for conceptualizing and creating the state plan. But the question then becomes, why do we need a state plan? So we need the state plan to help create and surface effective approaches that will help us to increase the safe, stable, nurturing family relationships that we need across the state. And it also helps provide a means of accountability. So by having evidence-based trauma-informed programs and tracking the outcome and the data from those programs, it helps us to see what's working and where, which then can be taken to funders, other stakeholders, and it just helps to expand the message. It expands the understanding of prevention and helps us keep that movement going forward to help support our families across the state. Another reason that we need a state plan is to capture the comprehensive impact of the efforts from all the different agencies, state, regional, and local agencies and organizations, the primary, secondary, and tertiary prevention efforts that are in place. again, really want to see more positive childhood experiences and the reduction of ACEs. So the state plan will tell the story. It's going to tell the story of where we are, where we need to be, and when we've reached our goals. So the program is, again, the work in progress, what's already happening to reduce child abuse and neglect and promote family well-being, what existing trauma-informed and evidence-based practices are being used across the state. Where are they not being used? Where is there training and funding needed that isn't currently in place? And then how has Georgia's child and family well-being improved to date? So the ultimate goal of the CANPP is to see a 10% improvement in child and family well-being in the state of Georgia. When the plan started in 2020, Georgia ranked 38th out of 50 states for child and family well-being. And you can see on the slide where we fall, we're not doing well with health, which is physical and mental health, family and community. We've got a lot of room for improvement across the state. In 2023, we did increase and we went up to 37th, but the ultimate goal is that by 2030, when the plan is at its 10th year, we will have moved from 38 to 33rd in the kids count data. And that will all come, again, from those evidence-based practices where data is being collected and then reported back. The vision, again, we've already talked about this, but going back, the vision is that Georgia's children and families will thrive in connected, nurturing communities where they live, learn, and play. So this is the state's plan, but it's also everyone's plan. And let me move on to the next one. So in developing the CANPP, it was developed at a state level. So the vision for child and family well-being was brought together with 25 listening sessions, a lot of different participants, stakeholders who were working in the field, working in policy, working in business, just trying to find out what do we need. Governor Kemp's office gave approval for this plan and was in support of moving forward with it. So those planning sessions occurred over several months. There were 14 sessions with service providers, 11 sessions with parents and caregivers, local leaders and government, civic, faith, and business communities. And we had over 635 people take part in these sessions. The surveys really aimed at a similar audience. They're shared statewide with both physical and digital formats that we shared those surveys across the board. So after hearing from all of the 14 DFACS regions, there were similar themes in the different communities. And so we came together and came up with these 6 objectives for the CANPP. And the understanding was that Georgia's plan must change the following conditions for children and family in the state. So increasing economic stability, increasing access to early childhood education, increasing family mental and physical health, and increasing community knowledge of societal factors that contribute to child abuse and neglect. So understanding that there's systemic issues, there are cyclical issues, that, this is not a one-size-fits-all solution or problem for that matter, and everyone bears a part in helping to improve the circumstances across the state. So now we have the state plan with those 6 objectives, but we have a really diverse state in Georgia. We have a lot of strong and large urban areas, but we also have a very significant rural population where people are spread out. So how does one plan serve 159 counties that have such diverse needs? The decision of Georgia Essentials and their working groups was to break down, like I said, into the 14 different DFACS regions and go to each of those regions and ask, what do you need here? What are you doing? Where does your community really see these, these 6 objectives? What are the ones that rise to the top? What's the most important to you? So from that, the understanding was that the plan was meant to be used as a tool to support the activities and the unique needs across the state. So in 2021, the 14 regions completed their own plans, and they developed a multidisciplinary collaboration. They established different action plans. They then went back and they review each of these plans annually. The people who are interested throughout the region can meet on a monthly basis with those leaders and discuss what's happening and what needs to happen. So since the plan started, you can see the activities that we've had. One of the big things that came from the regional implementation was identifying 5 communities of practice, which were the top 5 strategies under those 6 objectives that were chosen across all of the regions of Georgia. So the communities of practice are just, they're bringing together what's happening in the community, what the community sees as a need, and overlapping those to come up with the most important issues. The 5 strategies, the 5 top strategies that were chosen across the 14 regions of Georgia were life skills, increasing life skills training opportunities for school-aged children. 36% or 5 of the regions chose that as one of the top areas to work on. The next was safe and affordable housing. Again, 36% of the regions also chose that as a priority, expanding efforts to develop more safe and affordable housing. And then number 3 was evidence-based parenting skills and education. That was a big one. 50% of the 14 regions chose that as an important priority. So that was 7 of the 14 regions. Next was increase community knowledge and recognizing reporting child abuse and neglect. So helping practitioners, educators, the faith community understand what child abuse and neglect is, where they need to make a report, where they need to help provide support and resources. The last community of practice area that was identified was trauma-informed practices. Again, that was about 36% of all of the regions said that this was something that needed to be a focus in their communities. So these communities of practice, the decision was then made to, these needed to be elevated. There needed to be information sessions. People were hungry to learn more about it. And also, we still wanted to increase awareness of the CANPP. So what came of that was we do, Georgia Essentials provides fall and spring community of practice sessions. Each fall and spring, they offer 3 to 4 sessions. It's for information sharing and networking. They're all virtual meetings. There aren't CEUs, but we bring together someone or some organization from the state that's making headway in one of those 5 areas, and they present on the work that they're doing, help get people connected. It's a really great opportunity. And we actually have our fall communities of practice coming up in October and November. You can see the list here. And this, Audrey and Nikki are going to send this out, but the QR code there will take you to the registration link for that. So October 26th, November 6th, and November 8th. October 26th, it will be influencing social norms around child abuse and neglect, and ACEs, and positive childhood experiences. So we've got Angie Ginn from the CDC, violence prevention section, coming to speak about that. She's fantastic, highly recommended, and everyone's really excited. So hopefully you can join us there. And then on the 6th of Georgia, we're going to have Find Help Georgia present what they do. So if you're not familiar with Find Help Georgia, I'm going to explain that a little bit more as we go, but they are a resource for community engagement and informational referral. And they really have a beneficial model both for community stakeholders and professionals. They have a lot of great data tracking and things like that for your organizations. Last one is going to be family resource centers that serve families that speak languages other than English. Belisa Urbina from Serra Familia, who is amazing, and they have done so much with their organization. She'll be presenting. I just heard her present at the conference, the Child Abuse and Neglect conference, and she was talking about starting Serra Familia, and that they just did the things that people needed. So when people needed milk, they all brought in their coolers, and they got rid of their office chairs, and they sat on coolers for months until they could afford refrigerators, so they could provide milk for the families that said that they needed in their area. She's so innovative, and she's just really done a lot for the especially the Spanish speaking community. So I highly recommend her community of practice as well. So I know I've given you a huge mouthful about CANPP. I've probably repeated a lot of the same things because just want everybody to understand, where we're coming from with that, but to also say where we are today. So my position as the program coordinator was new. It was the first time there was somebody really jumping in with the leaders in the different regions and asking, how is it going? Is this working? And what we found was not a lot was happening. Communication was difficult. The regional plans were very aspirational. So a lot of the strategies and objectives that were chosen were where there was that need. But again, CANPP didn't come with any funding. So regional people who were involved at a regional level, and possibly some of you were at that time, or maybe you still are, but the people who were getting involved at a regional level were really tasked with some big asks, creating websites, surveying their area, just trying to get people to come to meetings. The plan started when COVID started, and we were all working virtually. So in that inception phase, everyone was at home. There wasn't travel time. There wasn't as much direct client time because of the COVID restrictions. But as things have opened up, it's been harder to get people together. So we really needed to go back and simplify the process. Number one, what we found is that everyone involved has a strong commitment to reducing child abuse and neglect and improving child and family well-being. So that is a passion for so many people across the state, both in social services and mental health, physical health, in the business community, in the faith communities. So we have a lot of support for this movement. We just need to get the word out and find out what's happening. So, and we know that a lot of this work is happening in Georgia across the 6 objective areas. So we've shifted, we've moved from Georgia having these specific regional plans that are really focused on just a few details in one area, and more towards where is the work that you're doing? Where is your passion aligning with what CANPP is about? Where is it aligning with those objectives, the 6 objectives of improving child and family well-being? So it's this reframe was, moving away from by adopting these strategies and objectives, you should reduce child abuse and neglect, and more towards the mindset of, if you're working on these strategies and you achieve these objectives, you will reduce child abuse and neglect. So it was really trying to harness what's already happening. And then by starting with what we know is happening, we can also uncover where there is a need. But we have to know what's happening first. We have to know what's happening well, and then discover how we can expand into other areas. And if we have time, I can talk about that more afterwards. So how can you help? Your support will help us realize the shared vision for Georgia's families, identifying what you do, promoting the CANPP in your community, incorporating the objectives if you haven't already, and kind of discovering and uncovering where that work aligns, participating in your regional meetings and the work groups if you're interested, and then just providing us feedback about how you think CANPP is going and what else is needed. So again, it's that where we are, where we need to be, and when we've reached our goals. So an example that I just wanted to highlight comes from a Resilient Georgia grant, and that is the Building a Region of Resilience, specifically in Northwest Georgia. As you all probably know, it's a grant-funded project building capacity to increase community awareness and advocate for systems change to improve resilience and long-term outcomes for children and families in Northwest Georgia. So their activities are, they maintain a training calendar, they keep information pathways open and move messages and information throughout their partner networks. But they've also created a priority map that is aligning the priorities of the state CANPP and the strategic plans. So we can see where those things are happening. So this is something that Resilient Georgia and the Building a Region of Resilience Coalition have kind of put together, and CANPP is a byproduct of that, and it's a huge help. This is their priority statement. What they're working on lines up with those objectives, right? Workforce housing, systems change, reducing abuse and neglect, and improving mental health. So what they've done is they have a color-coded map. And again, when this goes out, you can see their full version there if you don't already know about it. But they have a section that specifically shows where the work that they are doing to build a region of resilience aligns with those CANPP objectives. So that for us, that for Georgia Essentials, really helps to paint that picture and tell the story of child abuse and neglect prevention in the state of Georgia. So any support that you can give helps us to, this is a blueprint. It is meant to be a guide to kind of help bring our focus to the prevention efforts. And sometimes it means that things that you're doing that are prevention efforts that help build these strong families, you might not be looking at it as prevention, but it is. It's moving the dial on family health and economic stability, housing stability, and things like that. Or it's uncovering the real need and the absence of those opportunities within your communities. So again, just wanted to flash those objectives up there again. We've already been through those, but how can you get involved? If you're passionate about this, if this is something that means something to you and you want to get involved, you can attend those regional CANPP meetings. You can connect through Basecamp or Find Help Georgia, and you can contact Essentials for any kind of assistance that you have, any questions. That's what we are here for. So this is a list of the 14 regions and each of the contacts that kind of spearhead CANPP. Again, when this PowerPoint goes out, you'll have access to those email addresses, and you can find out when they are meeting, what they're discussing, etc. But you can always contact me at essentials@gsu.edu, and I can get you connected as well. Basecamp is a platform for networking and collaboration, and it is organized by region. So each region in the state has their own Basecamp platform. You can share upcoming trainings. You can share questions. It's really a place to network on an ongoing basis. And we also announce like communities of practice and other CANPP opportunities through Basecamp. So again, if you're interested in that, let me know through that Essentials email address. Next, and I know I need to wrap up here, but Find Help Georgia is a great resource, but it's also a great tool for telling the story of prevention in the state of Georgia. So Find Help Georgia allows providers to get connected. The requirement is that you have to be a free or reduced cost program to be part of the network. But any services that you offer, whether it's medical care, housing and financial assistance, education supports, childcare, workforce development, they will list you in Find Help, but you also can go back in and access how many people have been looking for what you offer, how many people are finding what they need, where can you get plugged in. So this is, again, I know that's a lot, but this is just all the different levels of engagement with Find Help Georgia. There is a widget and a website link that you can have on your homepage for your organization that will help get people connected. And the more we find that people are asking for things and they're not there, the more that Find Help Georgia will go back in and try to uncover where those places are. They have great technical assistance and really excellent data program analytics for you to pull from to see who's looking for you, who's using you, things like that. So where I can help you and where Georgia Essentials can help you is that technical assistance. Ask us questions. Do you need materials? We can give you materials about the plan, any slides or social media, things that you might need. We can provide that. we have an entire data working group, and their whole purpose is to help you with data, uncover those evidence-based trauma-informed statistics that you might need to help get a program funded in your area, letting you see or showing you what's happening already in the state. So they are really great resources, definitely underused at this point. It's a great group of people that are not necessarily data wonks. So they are really great at demystifying data in general. And then just the network, getting people connected. If just in the work that I've done already, I have been able to connect people in coastal Georgia with people in Northwest Georgia based on questions that they had and programs that they were interested in and where it's being offered somewhere else in the state. So it's a great network opportunity as well. I'm going to close up my presentation by there's a couple more QR codes there for you. And again, those are hyperlinked as well for when this goes out, but the actual state plan is there at the top, Georgia's Vision for Child and Family Wellbeing. That is the CANPP. That QR code will take you to the state's plan so you can see what the objectives are. You can always email me at essentials@gsu.edu for any Georgia Essentials questions. And then if you're interested in the newsletter where we announce those communities of practice and things, you can sign up for that there with that QR code. So with that, I'm going to stop sharing my screen and stop babbling on and see if anybody has any questions about the CANPP or any experiences. I'd love to hear what everyone has to say. Oh, I see Caitlin. Yes. Caitlin's one of our conveners, so she knows. She has been spearheading some work in her area around CANPP. So nice to see you.
Thank you so much, Beth, for such a thorough presentation. Lots of helpful information there. Does anybody have any questions? You can go ahead and put it in the chat if you're more comfortable with that, or feel free to unmute and ask anything.
I see a hand. Kamisha has her hand up. Oh, or maybe that was a mistake.
Oh, ma'am, I did have a question.
Yeah. So we have Irene, Barton, and Caitlin are both regional conveners. Irene is the convener for Region 13, and Caitlin is your Region 6?
Region 7.
7. Mm-hmm. Right area. But I know Irene is newer to the convening process. Caitlin has been doing it for a little while. I don't know if either of you would want to talk about your experience, but you know, again, one of the big changes is the plan is 6 objectives with 77 very specific strategies, and that was a lot. So just kind of focusing on those objective areas and using the strategies as a jumping off point, as a guide, as a way to connect, that can be really helpful also.
I feel like I'm behind, even though you assured me in September that I was not, and like I should be convening people already. And I have to, we have not had a Region 13 convening, but Kamisha, yeah, be on the lookout. And I think I saw Graydon on here as well from Gwinnett. So, and
Yes,
Angel from Clayton. So we'll figure it out.
Okay, awesome. We are definitely looking for it. I did when I saw your name on there. I was like, oh, okay, so we got to make that connection. So awesome. We'll be looking for it.
Yeah, I fell for the "it's what you're doing already" line.
And it is, and that's what it's intended to be. I mean, Irene in particular came on at a time when I think there were some big changes happening, and we're still going through those growing pains. But ultimately, we want to hear from you about the work that you're doing. And, you know, I was telling Nikki and Audrey before we started that Georgia is the first state in the nation that's doing this. And it's a big ask. I mean, and we have to remember too, we have 10 years to do this. So painting this picture of the state, painting the picture of evidence-based, trauma-informed services that are being offered, re-envisioning what prevention is. You know, you cannot have a healthy family if you don't have food, if you don't have housing. I know I'm preaching to the choir, but you know, our business communities need to understand that Georgia's #3 in the nation for doing business, but you saw the statistics of where we are on economic stability in the kids count data. It's incongruent, and it doesn't need to be that way, but we need to help the powers that be understand where the money needs to go and why some of these other efforts are just as important to prevention as the traditional ones that everyone is aware of, which is mental health and social services. You know, again, you have to have stable income, you have to have stable housing. And if we aren't providing that, then our families can never get healthy. And we have to be able to tell that story when people are meeting under the gold dome and making decisions about funding. And we're also learning, and I'm a big advocate for the storytelling piece and simplifying, because this is a complex issue and it can be very confusing when you're not working in it every single day. So how can we simplify and help other you know, the entire community, the ecosystem of Georgia understand the complexities of prevention and see where everyone plays a part. It doesn't matter if you think that you're a tremendous parent, you still can bear some responsibility for helping the rest of the state maintain that health of all of our families, whether it's through your faith community, your schools. You know, there's been great examples of where CANPP is helpful, that you know, there might be a program in your community that has funding, but maybe they're small, they don't have the voice and the bandwidth to get the word out about what they're doing. So getting connected with the CANPP then gives a voice to them where it can be shared across the network, and then maybe they can get into the places where they need to be. And we've seen some really strong outcomes for that with programs going into the schools and things like that. So it takes everyone's participation. And I just, I really appreciate everybody being here today and being part of the conversation. So,
Good
This is
afternoon, everyone. I'm sorry, Audrey. I'm Jackie L. Warner, and I am actually part of the Building a Region of Resilience in Northwest Georgia. I've also been on the CANPP team since its beginning. I attended the virtual meetings where Matthew and George, was that his name? The other, I can't remember, but anyway, from the
Chris.
state level and all of the planning and everything. And Irene, I just want to tell you, I know the amazing work you do in Cobb County as a family connection program down there. And you actually are one of the ideal people, because our family connection, Building a Region of Resilience, all of us coordinators up here have been able to link, and it is all about calling on the people that you know and asking them to help with this plan. And you'll find it will flow very smoothly once you start bringing everybody together, because we have had that experience up here, and with the assistance of everything we've had from Resilient Georgia too, it has really helped. Like, the networking and the partnerships are just amazing to make this work happen. And we have had a lot of really good meetings, and we are already seeing some progress being made in certain counties here. As Beth said, getting into the school system, things we didn't really expect could happen, but by the group working together as a whole in Region 1, we have definitely already been making some headway. So you can do it, Irene. Don't give up.
And you have in Northwest Georgia, you have such a great coalition. They've got Family Connection, they've got DFACS, they've got, and that is another piece of this kind of shift right now in the third year of CANPP, is that CANPP got all packaged and then handed down to the localities. They didn't want to tell people from at the state level, here's what we've come up at the state level, and here's what everyone needs to do. They really wanted the plans to be coordinated and activated at the local level where people really knew what the needs were. But unfortunately, that very good intention turned into the regions, the regional level and the state level kind of backing off of involvement. And we really need to break it down state, regional, and local. The local level needs to be able to tell the regional level what programs there are that can get into the schools. I mean, that's a lot of what's happening in Northwest Georgia with their building a region of resilience, is bringing that attention. And then from there, it can move up to the state level. But I'm really trying to do a lot of work to get in front of DFACs and let them know about the plan and talk about what people are doing. It is this big, nebulous, sort of amorphous thing that encompasses everything. So it can be really overwhelming. But I think getting a team together like what you have in Northwest Georgia is that is in some ways luck of the draw, because you've got so many people who are so passionate that stuck with it. So I'm hoping that we can help support other communities to do the same thing, because I know when I talked to Leah Phantom, who is with the Georgia Center for Child Advocacy, but also Family Connection Partnership. And, she said, well, we've already met some of our goals. And I was like, wow, that's amazing. So it can be done. But Irene, you can't do it by yourself. So it is partly figuring out where to draw other people in and bring them to the table. So, and I'm here to support you on that. No worries.
And just want to highlight too that you are already doing so much. And I think the priority map from building a region of resilience in Northwest Georgia is so super helpful. So we'll send that out with the resources, and we've shared it before, but they update it every year to really pull out different points of alignment, and also and call out what work is happening in different counties. I mean, I know this wouldn't count for someone who was thinking about anyway, what work is happening in different counties and also region wide, and then maybe alignment with other initiatives that interweave through it. So it's an amazing document. So we'll be sure to share that. And I see some folks in the lunch and learn that are from Southwest Georgia. I didn't get a chance to look at who would be the point people in those areas. So if they wanted to connect with them, they would just connect with you, Beth.
Yes, and I can pull that up and let you know. So which region are we talking about?
That's a great question. I get so confused with regions. So,
I know, because there's Family Connections, there's DFACs, there's so many other, but I will I will share my screen again and just pull up that if I can here. Let's see.
And so a lot of folks in coalitions, they convene their coalitions, they bring them together for meetings or lunch and learns that are region specific. Would their regional person be the person to reach out to share more information about the plan, or could they connect with you, Beth? And could you also share this information?
100%. It can go both ways. And there are, I think what's happening in Northwest Georgia, they chose very specific things to work on, and they're making progress on that. So that works for them. But for region 13, where Irene is newer, you don't have to go backwards and go back to the plan that was established by somebody else before. You can kind of look at it and start over. And this is one of those things where we don't have to do all of it. We can do some of it. We can pick one thing. So it's really what feels possible for you. And I can help work through those questions as well, and try to come up with a plan, a plan of attack, really, for where do we start? Because where you start is really overwhelming. I can say that from my own experience coming into this new in May, and just trying to understand the whole process and who's in charge and, all of those different things. So I'm happy to be a resource, whether you are a leader in your area or you're, interested in getting started. So definitely reach out.
And I saw that Caitlin just put in the chat, if you're in Region 7, or just want to see how the meetings kind of go, you can attend one of the meetings and sign up. And she linked that there. So I think Region 7's like Augusta area, right? If I'm not mistaken.
It is, yeah.
Okay, perfect.
Are there any more questions before we wrap up the lunch and learn? Okay, I will take that as a no. I just want to say a big thank you to Beth for coming to share all this wonderful information with us. And thank you everyone for spending your lunch with us, but also for all the work that you do every day. I'm so grateful for everyone on this call and folks who can't join us. So we will share follow-up materials after the call. Thank you so much.
Thank you, everybody.
Thank
Bye,
you.
everyone.
Bye.